Today, we have 3 guest speakers on our webinar. Jasmine Rockett, the manager of the Point of Care Ultrasound Certification Academy. Janet Hoyler, the clinical content and key account manager for 123 Sonography, who is also RDMS and RVT credentialed. Dr. Vic Rao, the manager of global clinical content and POCUS education for the Point of Care Ultrasound Certification Academy. Thank you to all 3 of our speakers for being with us today. Jasmine, I'm going to ask for you to start the webinar today and let you jump us straight on in.
Thanks, Maddie, and thank you all for joining us today and for taking the time to attend today's informational webinar on the POCUS Certification Academy POCUS Generalist Certification. During this webinar presentation, we're going to present the certification, share some of the resources we have available to help support you on your POCUS journey, and discuss some applicable benefits of POCUS for the general practitioner with a clinical review towards the end of today's webinar. The POCUS Certification Academy is a global community of POCUS users that aim to uphold the highest standards in point-of-care ultrasound to ensure patient safety. We offer online certificates and certification program to validate your point-of-care ultrasound proficiency. Our certificates range across 10 clinical content areas, including the fundamentals. We also have an emergency medicine certification and the POCUS Generalist certification, which brought you all here today. Understanding that POCUS as a practice is evolving and the technology is rapidly changing, the Academy offers POCUS resources to help you on your lifelong POCUS journey. Like this webinar you're currently attending, as well as other resources like our podcasts, blogs, tips, newsletters, and other support to help you on your POCUS certification journey, can all be found on our POCUS Certification Academy website. The Point of Care Ultrasound Generalist Certification tests and validates your knowledge in 8 specialty clinical areas and also includes a peer evaluation. The POCUS Generalist Certification is designed for healthcare professionals specializing in family practice, primary care, and general practice. The certification allows you to distinguish yourself from other users in the medical community by you making a conscious choice to stay abreast on advances in your field. A certification like this one allows you to obtain critical edge in supporting patient safety and provides you with the provides your community with the visibility of your commitment to excellence in patient care. Each assessment component is designed to verify pertinent POCUS competencies and industry-defined standards. Step 1 in ensuring and earning any POCUS Academy certification is earning the POCUS fundamentals. The fundamental certificate provides you with the foundational education review of ultrasound, offering 8 educational modules covering the core competencies of ultrasound physics and instrumentation. These modules are interactive and have knowledge checks along the way. At the end of the modules, an assessment is administered to test your knowledge. Once the fundamentals or its equivalency is completed, you can move on to pursuing your POCUS Generalist certification if you've met the prerequisites. To be eligible for the POCUS Generalist certification, you must hold a current POCUS fundamental certificate or its equivalency, be actively practicing point-of-care ultrasound, and have completed the minimum number of cases required across the 8 content areas within the last 2 years. For DVT, you'll have to complete a minimum of 20 scans, AAA 20 scans, cardiac 30 scans, MSK and renal 20 scans, OB first trimester and hepatobiliary spleen 25 scans, and lung 20 scans. The POCUS Generalist certification is comprised of 8 clinical content area case assessments. These assessments simulate how you practice point-of-care ultrasound in your daily practice and require you to review ultrasound videos and clinical findings and synthesize the information to ultimately make a diagnosis. In addition, there will be a peer evaluation that has to be completed on your behalf. The peer evaluators will be asked to assess your abilities to obtain point-of-care ultrasound images and your understanding of various aspects of point-of-care ultrasound like depth, gain, view, and compression. Our program is unique and offers a wide variety of benefits to the user as well as to the POCUS community. Our program is global and designed to work with the busy lives of healthcare professionals. Therefore, our assessment results are provided immediately and can be checked anytime on your certificate plan. Earning the POCUS Certification Academy Generalist certification gives you documented proficiency of your POCUS skill set that is supported by a nonprofit organization with more than 40 years of experience using scientific methods to develop and validate proficiency in ultrasound standards of practice. Our exams help establish high quality standards across the ultrasound industry. Once you've successfully completed your certificate, you will receive an electronic printable certificate as well as a digital badge that can be used to share your accomplishments on various social media channels. We have streamlined the application process for earning a POCUS Certification Academy certificate or certification, making it quick and easy. Once you're ready to start your POCUS Generalist Certification Academy journey, you will log into the POCUS Academy by selecting the Apply button on any of the POCUS Academy website pages. If this is your first time applying, you'll be directed to a short questionnaire asking you about your level of practice, specialty area, and asking you to create a username and password. Once you've completed the short questionnaire, you will select the green Apply for Examination button. This will direct you to the page where you can select the POCUS Generalist certification or any other POCUS Academy offering. When the certificate is selected, you will complete steps 1 through 4 of the application process, which include attesting that you've met the prerequisites and other requirements, providing the name and emails of your peer evaluators, and paying. Once the application steps are completed, you will have access to begin your assessments immediately if you choose. To help support you on your POCUS Generalist Certification Academy journey or with any other POCUS Academy offering, we have launched a POCUS Educational Provider Program. This program will provide you with the educational resources you may need. We have partnered with one of our POCUS educational providers, specifically 123 Sonography, on a joint offering, the POCUS Generalist Certification course, to help you successfully pursue your POCUS Generalist certification. I'm going to turn the time over to Janet from 123 Sonography, where she's going to share some information about the organization as well as the POCUS Generalist certification course.
Thanks, Jasmine, and thanks also to Maddie. I'm happy to be here. We at 123 Sonography are delighted to be partnering with the POCUS Certification Academy to provide you this educational and certification bundle. 123 Sonography was founded in 2011 by Dr. Thomas Binder, who decided to bring his two passions, teaching echocardiography and film, together to produce high-quality ultrasound courses online. As of today, we have 15 courses today, because we actually just launched a course today in musculoskeletal injections as well. We have 15 courses on our platform, which represent over 130 hours of video content and more than 10,000 multimedia quiz questions. And all of our content is Category 1 AMA and PRA CME accredited. As you can, in the next slide here, let's go up to the next slide here. I'm going to play a video in just a second. As you can see in that trailer, our content includes theoretical lectures, tips, tricks, scanning sessions, case presentations, interviews with both patients and practicing experts in the field. We like to keep things mixed up and so that you don't ever lose interest. Go ahead, Maddie, and play the video for me, please. So if you go ahead and sign up for this education certification bundle, you'll have access to 123 Sonography's POCUS Focus class, which you just saw the trailer for. The class is comprised of 9 chapters, including cardiac, abdominal, aorta, lung, urinary, musculoskeletal, OBGYN, biliary, and DVT. If there are more than 4 hours of video content, within these 9 chapters, you'll get a 4.25 Category 1 CME credits. By coming together on this project, we're able to provide you with education and certification together and give you at a much better cost. A fraction of the cost of the individual components separately. For just $798, you'll receive access to not only the entirety of the POCUS Focus class from 123 Sonography, but also the Point of Care Academy's Generalist and Fundamental certification programs. To get started, you need to go to the landing page that is listed here at the top of the screen. You'll also get this link forwarded to you, so don't worry about writing it down. And once you're there on the landing page, you can locate the fields that look like these fields here below, where you see the little screen and uniquely empowered by POCUS over there, and then the buy now here is where you're going to want to click. Once you click that, you'll get a pop-up window up here, and you enter your email address. That gives you a couple of free lectures just to make sure that you really want to go forward and you like what you're seeing and the style of the content that's provided. Once you receive access to the free lectures, you'll then be prompted to complete the transaction. So why go through all of this? As you all very well may know, point of care ultrasound is expanding rapidly. Although you may be interested in incorporating it, you may not definitely feel that it's within your comfort zone. So using point of care ultrasound, it doesn't mean that you have to change your current practice. It just means that we're giving you some eyes on the inside. We're helping you to target, expedite the diagnostic process, the intervention, and also treatment for your patients. So let's look at some examples. Here is the first case. This is one of our 60-second cases from 123 Sonography. So a young man presents. Here's what we look at, what we found when we put down the transducer. We've got some premature closing of the aortic valve, reduced mitral valve opening. Left ventricular function is pretty low. And then there's this area here that they're highlighting. Looking again now at a 4-chamber view. We always like to look at more than one view at a time. Again, we can see that the left ventricular function is pretty low and that there's some mild mitral regurgitation. So what it all comes down to, what do you think this thing is? It's kind of fluid looking. They say it looks like jelly. Hopefully they don't have some jello in their heart there, but if we go to the next video here, it will walk us through the answer. The LAD is occluded. We can see here on further testing. And again, we see the premature closure of the aortic valve, this jelly-like thing, and the reduced mitral valve opening. So it turns out that this is a clot. This is thrombus here stuck to the mitral valve, the side of the left ventricle. This is one of those things that putting down the transducer and seeing this at the bedside could absolutely change your management of this patient. So they've had an LVAD implanted and all is well. Going to one more case before I turn over things to Vic for some more cases is this one here. This is a parasternal long axis view. We can see here the left ventricle, the right ventricle, the aortic outflow tract, and then over here the left atria. The aortic valve here, mitral valve here. And a couple of interesting things on this view. First of all, it appears that the walls of that left ventricle are almost kissing. They're almost coming together completely, which is a little concerning. But even more so is what we like to see, that the right ventricle, the aortic outflow tract, and the left atrium are all approximately the same size. It appears here on this one that the right ventricle is larger than the other two, which is a bit concerning. If we go ahead and look at a second view, as I said earlier, we like to see everything in two views. We have here the parasternal short axis view. Here is the left ventricle. Here is the right ventricle. And we typically like to see this presented so that the left ventricle is like a donut and the right ventricle is like a croissant sitting on top of the donut, sort of hugging it. As you can see here, that's not exactly the case here. It looks like the right ventricle is larger than the left ventricle, and actually because of that, it's causing a flattening of the septum, or what we call a D sign. And that is one of the signifiers of right heart strain and potentially a PE. Okay, and so up next, Vic will share some more great cases with point of care in mind.
Hi everyone, this is Vic here. I'm going to be sharing some 5 interesting cases that came along. Case 1, we have a 67-year-old male patient with a history of smoking. Previous abdominal aneurysm screening done at a lab was reported as normal, and patient was asymptomatic and no other significant medical history. And when this ultrasound was performed by Dr. Stephen Burns in Florida, he was shocked to find that, that just doesn't look like a normal abdominal aorta. And so he contacted me and we went over the case, and apparently this was diagnosed incorrectly. So that's the reason I'm sharing, because sometimes we see that when you have a large aneurysm in the abdominal aorta, then generally because of stasis of the blood flowing really slow, there will be a clot formation, especially in the large aneurysm. So this was reported as 2.1, which is actually the wrong way of measuring the abdominal aorta. So let's go to the next slide, which actually shows us the correct way of measuring. You should always measure from outer wall to outer wall and should include the thrombus in the measurement. And be aware that all large abdominal aortic aneurysms will have some form of thrombus present. Especially if it's been long-standing for years, then you might see that the thrombus might become hyperechoic. Like over here, you can see it's barely visible. You can't really tell. You can actually blend. So make sure when you're scanning the patient that you actually have proper lighting conditions. So turn the light off or light low. And when you do see a thrombus, then definitely make sure you include the thrombus in the measurement, and that is the correct way of measuring this. And this patient actually went ahead and had surgery the next day, and the patient is doing great well. So this is a lesson learned, that we never miss abdominal aortic aneurysm, especially large aneurysm with a clot inside. Make sure you always measure outer wall to outer wall and include the thrombus in it. So don't be measuring this. This is not of interest. So we go to the next patient, which is not as critical. Of course, it's a 25-year-old female patient, comes in, has no history of trauma, but pain and swelling in the tubal tuberosity, as you can see here, and no other significant medical history. And this was also performed using high frequency linear transducer and is placed right at the region of tubular tuberosity in the midline longitudinal view, probe marker pointing cephalad. You can see here, this is the tibia and its fragmentation of the tubular tuberosity. And also notice that this region seems a little bit thicker, which is better seen in a more of a panoramic view. So this is a panoramic view obtained. You can see this is the patella, and we have the patellar ligament all the way down. You can see this is normal thickness. So here it seems to be a little bit more thicker. And along that, we have fragmentation of the tubular tuberosity as mentioned earlier. And that is suggestive of Osgood-Schlatters disease. So you might encounter these individuals coming in, and it's not really a fracture, it's just a Osgood-Schlatters disease. Third case, we have a 12-year-old male patient. This was reported by Dr. Adi. He was on the ultrasound fellows and trained, and he was in Sudan. And he found this patient who had a history of recurrent UTI and pain in the lower abdomen and no other significant medical history. When the ultrasound was performed, he found that this was the bladder of the patient, and he found these echogenic structures, which are the calculi, large calculus calculi present inside the bladder, and also the bladder wall appears kind of thickened. So the diagnosis obviously was, bladder calculi along with probable cystitis, and the surgery was performed, and the large stones were recovered. So just point of care ultrasound can make a huge difference, because this patient was getting treatment for UTI for several years, and actually the patient just happened to have stones in there, and so those were diagnosed with the point of care ultrasound. And here we see the large echogenic calculi, and of course the posterior acoustic shadowing. If we did color Doppler, perhaps we'd also get some twinkle artifact as well, but this is a very obvious and clear diagnosis. Case 4, we have a 45-year-old female patient, obese, intolerance to fatty food. That's almost giving away the diagnosis here, but I still wanted to put that in there. And we have the patient presented with right upper quadrant pain for on and off for 1 year. No acute pain right now. Murphy's sign is negative. When his attendant is also negative. No history of fever. No other significant medical history. And when you do the ultrasound, we found that the patient actually had a large single calculus echogenic structure, which is a gallstone present inside the gallbladder. And I've kind of labeled the image so you can see what things are. This is a gallstone with an acoustic shadow. And of course, this is the lumen of the gallbladder. So it's present not in the neck. This is the neck of the gallbladder. This is the body. And that's the fundus. And of course, that's the liver. And this is the portal vein. And so we see acoustic shadowing here, and so we see it's not obstructing. The wall is not that obviously that's thickened, but we didn't measure it in this time, this image. And but ideally, to measure the wall, you should measure the anterior wall of the gallbladder, and that the wall should be measured only when the gallbladder is adequately distended. So you want your diameter to be about 2 centimeters. Because if the gallbladder is contracted, it might appear artificially thickened, but definitely we can all agree that this is a case of gallstones or cholelithiasis. Next, we have a very interesting case donated by Dr. Mike Wagner to be shared. This was an elderly male with a history of tobacco use and COPD. Patient presented with dyspnea, cough, fatigue, and gives a history of failure to thrive. Examination, the patient was afebrile, vital signs stable, expected the pulse ox was 85% at room air and 90% and 4-liter oxygen. And the chest x-ray showed left chest white out. So let's look at the ultrasound. The ultrasound was performed. And of course, the left side, you see, this is the zone L1. And you can see here, this is what was seen. You can actually, normally we expect A lines to be present because lung is aerated, and so we should get A lines, but instead what we see here is we see an effusion, and we see a mass over here, which actually is a mass, and also some sort of maybe collapsed lung over here, atelectic lung or consolidated lung. The second image, that slide also to that kind of shows that these are vessels. So we see the abdominal aorta all the way through, and normally this is not seen, but it's a very unique situation because there's fluid and there's no air, so it's allowing like an acoustic window all the way down to the abdominal aorta and the spine. And then of course the next slide shows L3, where it's in this zone here, upper lateral, and we can see that the patient has completely collapsed lung. There is no air inside the lung at all, because otherwise you see some air bronchograms, and of course we see fluid, which is going to be the pleural effusion, and these are the ribs. So it's a very beautiful case, and thanks to Dr. Mike Wagner for submitting this, for sharing on the webinar today. And so of course, lastly, we have the lowermost section, here, L4. Same thing, you can see the spine, we see the collapsed lung. We can also see some sort of fibrinous bands running through the fluid. And so the diagnosis obviously is going to be, in this case, is a pacification of left hemithorax due to pleural effusion and consolidation. And also consolidation was caused a little bit by the atelectasis from the large mass, as well as the fluid compressing. And the pleural effusion is the type 3 fibrin strands. So thank you very much. This brings us to the end of this presentation, and thank you very much.